We found a way to put muscle activity back into a paralyzed arm by placing our neuroprosthetic sleeves. Well, Kyle was referred to AxioBionics by a physical medicine physician who was treating him for left-sided hemiplegia. And that entails, trying to work with an arm that has been paralyzed by some event. He was experiencing unrelenting seizures that necessitated what is called a hemispherectomy. In the process of doing that, it will paralyze the opposite side of the body. There's a trade-off, of course, because you can't live your life with unrelenting seizures. So the only thing that can be done is to go in and surgically remove the area. And if the motor cortex is involved, it's going to leave the opposite side of your body paralyzed. But in Kyle's case, he has some brain control. And so we wanted to help improve his functionality. You don't want to put it in a sling. You want to do the exact opposite. You want to encourage muscle activity. You want to encourage the connection between the brain and the muscles. You're looking to help this individual use this arm in a manner that he isn't able to do. But in addition to that, you want to diminish the known problems of paralysis, which are muscle spasms, joint stiffness, contractures, wherein the hand will clench, the elbow will flex, and then it kind of leaves you with a clipped wing in a sense, and it's very difficult to use an arm like that. We found a way to put muscle activity back into a paralyzed arm by placing our neuroprosthetic sleeves on these patients, which stimulates the muscles. When you do that, you enable the patient to access muscle therapy daily, and that arm is active the entire time. It's not that it's inducing functionality, but it is making the muscles move, contract, and otherwise be very active. And in that process, we're helping to increase the connection between the brain and the muscle. That's called muscle re-education. And if you can lower the muscle spasms that tend to restrict movement, then that patient's arm will be easier to move. If you're locked up by muscle tightness, even small amounts of brain control will be rendered null because you can't move against the restrictions of muscle spasms. So it's important for us to alleviate those spasms, to allow the brain to start using the muscles more effectively.